pigmentation, such as melasma, where people have dark patches on their cheeks, on their forehead, mainly on the cheeks, but also can sometimes be on the forehead, nose, chin, jawline. This is almost considered something like diabetes. It's like chronic. It is long term, but you just have to. But it can be improved and maintained with treatments. There are more less common causes, even like allergy to allergy to the cosmetic products that you're using can cause pigmented changes called Reels melanosis. Physiological pigmentation, so it's in the form of a V on the cheek, or rough dark patches on the back of the neck, underarms, and that can cause pigmentation on the face. So there are many, many causes, and it requires a specialist to actually consult and diagnose the cause.
Yeah. So I'm gonna play a bhajan next. Good morning again. We are back on the radio now. I think I've got the feedback on our Facebook page. So let's go back into our chat about the pigmentation. I'm interested in to find out what sort of treatments are available. I know you are so much involved with NHS and what people can do and how they can access.
Okay, so yes, so there are different treatment options. So I'll go through everything that is there. So it can be as simple as just even regular, if people with dry skin, if they have pigmentation, even simple thing as moisturizing, which is unbelievable, even moisturizing regularly can improve the tone and make it more even, because just dry skin causes accumulation of the pigment in the skin layers. The pigment is called melanin and it gets accumulated in the skin layers. Then there are other treatments which are creams, which we call topicals, and these can be anything from things that are available over the counter, such as those which lightening agents. The ingredients to look out for are things like licorice, arbutin, kojic acid, azelaic acid, vitamin C, niacinamide. So all these are available in products over the counter, but it's important to I'll go through the products, which products in a bit, but it's important to choose good companies, because there are many cosmetic companies out there which are dishing out creams and with huge cost, all due to marketing, but may not have the ingredients in the right concentration or bioavailability. Apart from that, there are prescription creams. A popular one is called Pigmenom or Triloma, and in the NHS we call it it's a made up called a bleaching cream. It contains a skin lightening ingredient called hydroquinone, which inhibits a tyrosinase pathway, which is one of the pathways by which pigment is produced. It has 3 ingredients in it: hydroquinone, a retinoid, and a steroid. Now, this is the most effective and gold standard treatment for pigmentation, and it is prescribed in the NHS. Also, it can be available outside privately. If these are mostly effective, if not, then we can go for higher treatments called chemical peel. Chemical peel is a condition where a chemical solution is applied on the skin and left on for a few minutes, and that takes the top layers of the skin out. When the top layers of the skin come out, all the dead skin, which has all the pigment cells in between, come off with it as well. And that also causes new skin to go through, to grow through, and that helps improve pigmentation. Repeated treatments are necessary for this. All this can be discussed when people attend for a consultation. And the bonus is, apart from pigmentation, peels help with improving the texture, help improve wrinkles. So yes, it is worth pursuing. Now there is laser treatment available for pigmentation, something called Q-switch laser, which is a pigment-specific laser. That helps to treat pigmentation as well. And the more latest treatments that are available, there's a new cream called cysteamine. It's not prescribed, it's not allowed to be prescribed in NHS, but it is available. And it has giving us mixed results in the new studies. So that's something worth considering. Again, there are oral treatments. Now that is the main thing. There's an oral medication is very new in the horizon. There are quite a few called tranexamic acid, polypodium, etc. All of them are in early studies, but the most effective one at the moment is called oral tranexamic acid. There are very few dermatologists in the UK who have training and expertise to prescribe it. Now, this in the studies, it has shown really good results up to from 50 to 80% improvement of pigmentation. However, like I said, with conditions such as melasma, it is recurrent. It keeps coming back. So there is a way to manage it. So because there's a small chance, it comes back, but with this tablet called oral tranexamic acid, it doesn't come back as severely, is what we are seeing in the studies. So that helps. So it is less obvious, a bit milder. So that helps patients go back to their daily living without being very conscious. There has to be, with all these treatments, there has to be a treatment and a maintenance regime where initially we treat, and then there has to be something that maintains the treatment because it keeps coming back, which all these which are usually discussed in consultations. The most important treatment and prevention of pigmentation is sun protection. Because whatever we do to treat, and even if you have the best results, if you do not protect your skin from the sun, the UV rays is the main cause for pigmentation, UV and visible rays, and it keeps coming back. So it is important to use sunscreen, which are broad spectrum, which protects against UV light, UVA, UVP, and visible light. Now, picking up any sunscreen over the counter is not going to help because it doesn't cover all these, it doesn't protect against all these sun rays, and it is not enough to reduce pigmentation. Therefore, we can go through it a bit, but there are specific sunscreens and specific ingredients that we need to look out for pigmentation.
So I mean, I was quite interesting when you said about the sun rays. You know, we always obviously have brown skin, and I'm guilty as well. You know, I go out in the sun and I don't do any protection. It is very important, isn't it? Really, what's the difference with somebody who's got a white skin and the brown skin? Is it the same sort of sun ray penetration?
Yes. So with the very fair skin, which we class as skin type 1, 2, they have no pigment in their skin, which we have called melanin. And because of lack of pigmentation, they have absolutely no protection from the sun. And therefore, they need to apply sunscreens. But the reason they are applying is more to prevent skin cancers. That's what they are. The reason they are applying is to prevent skin cancer, to prevent sunburn. So that is for the fair skin. When it comes to darker skin, so from skin type 3 onwards, we call it. So from kind of, like I said, European, Hispanic, Latino, Asian, African, from this skin onwards, the melanin is protective to some degree. So it protective against burns and skin cancers, although it is not zero. So I don't want people to think, oh, we're never going to get a skin cancer and so we are fine. No, there still is a risk, but it is less. And therefore, we do need to continue sun protection for all these reasons to reduce. And I must say, for people who live in, say, Indians living in India or Africans living in Africa, they are exposed to a lot of sun. So there is skin hardening. So they don't burn as much as someone like Indians living in cold climates, temperate climates. We don't face the sun throughout the year, and therefore our skin tolerance goes down. And when we are suddenly exposed to sun, when we go abroad, go back home, or go on a holiday, there is a possibility that we can burn, we can get sun allergy, which is called polymorphic light eruption. Then we have a smaller chance of skin cancers. Also, it prevents aging. With sun makes our skin it causes development of all signs of aging. We age faster with sun, and also the pigmentation. So there are lots of reasons why we should protect our skin as well.
Well, it's such an important thing. You know, we are covered by the skin, and sometimes we do not take as much care. Very interesting topic this morning. Are there many places where people can get help? And I know you have an organization in. Are you in Manchester? Aren't you?
I'm in Manchester, yes.
Yeah. So do you have a place where you operate from, and how people can get in touch with you?
So yes, at the obviously I work in NHS, so that is a different system to get in touch. You'll have to be referred by your GP, and so that is one aspect. Then in the private sector, people can visit my website, which is called Varna Pigmentation. So it has all the details in there. People can book for consultations there. And I work in a clinic called My Cosmetic Clinic. So that's where I base myself from. So in the current coronavirus situation, help can be provided online by video consultations. That is a possibility as well.
Yeah, so we've got lots of listeners all over the UK and some overseas as well. If anybody wants to ask a question, please do message me on 07957 You should know my number by now because I've been giving that out every day. Yeah, it'd be good to have some feedback from the audience. Also, we are on Facebook. If you go onto Bolton Hindu Forum's Facebook page, we'll be posting this video on, and we'll also put all the details that important information. I'm going to play a short bhajan, and then we shall talk a little bit more. Dr. Rajani Nalluri, she's from South India, aren't you?
Yes, I'm from South India. I'm a bit of a mixed background. Father is from Hyderabad, so Andhra Pradesh, Telugu. Mother is Telugu speaking, but from Chennai. So a bit of Tamil and Telugu. So yeah, I'm a pure South Indian, mixed South Indian, if you like.
Yeah, of course, in UK there are so many doctors and medical. Uh, I know lots and lots of people. They all come more or less from south of India. So there are quite a few organizations that are involved with our radio station as well. We've got programs running every day with different community regional programs. So it's very good. Thank you for coming on to the show today. So talking about skins, one of the questions that maybe I should really ask is, why do people seek treatment? Does it affect people's quality of life, psychological or whatever,
Yes. So it is surprising that although pigmentation is classed as cosmetic and not probably important, if you like, that is not the case. There are many studies from America where people have, there's a world expert in America, and he conducted a study and found that patients with melasma, they suffer from low self-esteem, they're very conscious, it affects their job, their daily living, their sense of freedom, they're not able to go out and meet people and socialize as normally, affects their family life. And this is replicated in studies from Singapore, Brazil, India, in UK as well. We are collecting data and I will be publishing something soon. But in UK as well, I'm seeing in clinics that people with melasma have hugely, it affects their quality of life. And I've compared it with other facial skin conditions such as acne or facial, even eczema, psoriasis. And I myself was surprised that pigmentation was scoring higher in affecting their quality of life compared to these conditions where acne actually can cause scarring, eczema and psoriasis can be symptomatic. Still, pigmentation causes a huge impact on people's quality of life, causes a lot of psychological distress. So it is not something to be taken lightly, and people should receive help wherever possible.
Okay, there is a question that's come up. It says, my friend is 70 and she gets hair on her chin. So she plucks them and that area has gone black. What can she do?
So that is a very common, typical problem. Again, like I said, with darker skins, where any trauma to the skin causes pigmentation. So typical upper lip, chin plucking irritates the hair follicles, and that causes inflammation, and then that causes darkening. So important is to use lighter plucking is probably quite harsh for hair removal. Using milder methods for hair removal, as a laser hair removal, if it is affordable, is the best because it's out once and for all. And then using skin lightening creams will help lighten the pigmentation. So creams containing vitamin C, which can be mild and it lightens the skin. Important to do that. Sun protection, like I've said, keeping skin moisturized will help lighten the pigmentation that is caused. But important is to stop the trigger, and the hair removal methods has to go for lighter methods. Maybe it's worth trying another method of hair removal, like even kind of using hair removal cream maybe, and see if it causes less irritation, because plucking is quite traumatic and that can cause inflammation.
And it's hurtful as well, isn't it?
It is.
I've tried that many times. Yeah. Okay. There's another question here. It says a question from Bharti, and I'm listening to your broadcast. Can you please ask the question? How do Asian women reduce really bad dark skin under eyes?
Yes. So that is I wanted to touch upon that. It's a huge topic on its own. Dark circles are a very common problem for most Asians. Now, there are many causes for dark circles, and so it depends on what the cause is. Sometimes it can be hereditary, where the way your bones are structured, it leaves a depression under the eyes. If that's the case, it is difficult to manage that. Still, it can be filled up with what we call fillers, where it's an injection under the eye, and that helps fill that gap. It's because that shadow is what is causing dark circles. Sometimes it can be just pigmentary changes, and then again, skin lightening creams can help reduce that. So there are eye creams available which have skin lightening agents in them. There are the milder lightening creams that are there for the face, which contain, again, like I said, licorice or arbutin or vitamin C. That can be applied around the eye. Again, after that, again, sometimes it can be due to aging, and when aging occurs, the bone around the eyes, it resorbs, and that causes depression, and that causes the appearance of dark circles. Again, fillers is the choice for that. Again, lifestyle is important. We all know that when we have less sleep, well, we are tired, we look dark, and that is because the vessels in the skin become more prominent. So a healthy diet, good sleep, good deep, I don't know, 6 to 8 hours sleep, whatever your body requires is important as well.
Yeah, talking about sleep. I mean, when you get to a certain age, sleep seems to be very little. I mean, I'm up in the night. I do take as much rest as I possibly can, but yeah. So we talked about some home remedies. Any more tips that you want to maybe give on home remedies?
So yes, so home remedies are there. There's a place for it. It can help light. If you come back from holiday, your skin is tanned, home remedies can help. Home remedies can help smoothen the uneven tone. But I must say that home remedies are not enough to treat medical causes of pigmentation, such as melasma, or like I said, inflammation, inflammatory causes such as lichen planus pigmentosus or pigment demarcation lines. For those serious causes, home remedies are not enough. But home remedies are there for milder causes of pigmentation. So what are the options? See, our very own lemon, which has a high concentration of vitamin C in it. So mixture of lemon, honey, and rice flour. And then you can add a few droplets of vitamin E oil into it and apply that pack for 10 to 15 minutes. That's quite helpful. A pack of papaya, a pack made of ground almonds and yogurt. Ground almonds has vitamin E in it, and yogurt has lactic acid in it. And that helps, leave that on for 10 minutes. That helps lift a little bit of the darkening. I'm not going to say it will make you 10 shades lighter, but it will give you a bit of a glow and make your skin brighter. Milk is very good. Again, milk has lactic acid in it. So milk with a little bit of lemon juice and honey. Aloe vera, fresh aloe vera is brilliant. It has aloin and allosin, which are actives in it, which helps with pigmentation. Then we've got our very own turmeric. Now, turmeric has been used for centuries in our culture, and today the world is all getting worldwide recognition. But it has been in our armamentarium for ages, and it has an active ingredient called curcumin in it. And even there are 2 studies from China and another one from another Asian country where applied turmeric daily for 4 weeks has improved pigmentation and fine lines. So no wonder our brides get this turmeric massage, which is a culture that has been passed on. So that is an option as well.
Wow, it's just amazing, isn't it? Some of our, traditions are coming forward into this.
Exactly.
I'm amazed at your age because you're quite young compared to us, and you know so much about it. So you have absolutely spent a lot of time on studying this, haven't you? It is a very specialized subject.
Yes. No, I really am passionate about pigmentation and improving the kind of lives of skill of color people and helping them get recognition for their conditions. So that's
Yeah. Okay, so there's another question. What about diet to reduce pigmentation? Is there anything that people can do on that?
Again, I'm not going to say die if you eat so and so for 4 weeks, your melasma is going to disappear. No, that is not going to happen. But there are some dietary which have active ingredients, and that helps lighten gives you a little bit of lightening over time. And I must say the healthy diet, which I'll go through which ones, also helps reduce premature aging. So, and because in Asians and darker skin, aging itself causes pigmentation. Overall, it can control it, but it's not going to be enough on its own to treat. Now, there are many diets with lots of antioxidants, such as polyphenols, all these, which kind of mop up the damage that is caused by UV rays. UV rays causes free radicals to form in the skin, and that causes all kind of aging signs, and with aging, there's pigmentation. So a diet with these antioxidants help to mop up those free radicals and reduces that. So over the years, it will help. What are they? So foods rich in vitamin C. So as we all know the common lemon and oranges, but I must say our very own amla or gooseberry, it has vitamin C 20 times higher than orange. So it is very important that not to kind of ignore it. That is really quite potent. So an amla a day is really quite potent. Then we've got ingredients with vitamin A. So our green leafy vegetables, kale, spinach, and then papaya. Again, foods rich in vitamin E. So almonds, walnut, sunflower seeds, avocado. Dark chocolate is rich in antioxidants such as polyphenols and flavonoids. The other important, interesting one is green tea. And there have been a few studies out there where green tea drinking, I think if I'm right, about 5 to 6 cups of green tea a day has shown, if drank over 4 to 6 weeks, it does, in the skin, it has shown to have an anti-aging effect.
Wow. Yes. Another question from Praful Bhai in Ayurved. He says, what options are there for psoriasis?
Okay. So psoriasis does not come under pigmentation, but that's fine. There are options. I must say, there are lots of options for psoriasis in the NHS. So it depends on the severity. There are creams which are available, and creams such as which contain active ingredients such as vitamin D derivatives. All these creams, they are helpful if your psoriasis is very mild. Then there are there's a light therapy called phototherapy, where UV rays, because the sun rays are very powerful. They suppress the immune system. And the problem with psoriasis is your immune system is gone all haywire. So there is a controlled UV treatment called phototherapy, which is done in the hospitals. That helps with psoriasis. Now, I must warn that I wouldn't advise people to jump onto sunbeds, because sunbeds is unregulated UV exposure. But in hospitals, we do a regulated and calculated treatment. Then there are tablet treatments, which actually suppress the immune system, but help with psoriasis. So this is reserved for people with very severe psoriasis. And then there are injection treatments available as well. All these are available in the NHS. Injection treatments called biologics, which has been kind of changed the picture of psoriasis completely. And for very severe psoriasis, it has been life-changing for many. So that's an option as well.
Wow, it's such an important topic. We're getting quite a few people interested in this, which is amazing. I'm going to play one more bhajan, and then we can talk a little bit more about. So, very interesting topic today. We are talking about skin, and we've got our specialist, Dr. Rajani.
Yes.
Good morning again. You're still with me, aren't you?
Yes, I am very much.
Yes, yeah. So the pigmentation, I think one of the questions, maybe I should have asked that earlier on, what's the cause of pigmentation? Did we cover that? No.
Sure. I've given you like a broad base of what are the different causes of pigmentation, but this is more like what is the mechanism.
Yeah.
So pigmentation can be due to external factors or internal. External is sun, which I said is the most important. Then it can be anything, any insult to the skin, like trauma, scratching, constant rubbing, which we never think, certain medications. All these are kind of external factors which can cause pigmentation. Then you've got internal factors. Internal factors are produced from inside. So It could be genetic predisposition where it runs in the families. So you could have a kind of a grandmother who had melasma, and then it's not as definite inheritance, but it runs in families. You can always have an aunt or a grandmother, someone who had pigmentation like you. And then certain medical conditions such as hypothyroidism, very important, that can cause dry skin and that can cause pigmentation. Other endocrine conditions such as additions that can cause pigmentation. And then hormonal changes. This is the most important. Hormonal changes, these hormonal variations in different phases of a woman's life, that can cause pigmentation, the most important melasma. So oral contraceptive pills, pregnancy, menopause, and these are kind of defining times at which melasma develops, and then it becomes chronic after that. What is the mechanism in the skin? In the skin, there are different layers, and in the top layer of the skin, there are pigment cells called melanocytes. These produce a pigment called melanin. Now, in people with skin of color, melanin pigment is evenly distributed throughout the layers of the skin. And because of that, it gives us our color and it's an even tone. But there is a trigger, such as, like I said, sun or any of the above, it causes these pigment cells called melanocytes to become activated. And then they increase in size, increase in number, and produce more melanin. And this melanin accumulates in different parts of the skin, and that leads to these dark patches. One thing to understand is pigmentation. When it is early, it can be just in the top layers of the skin. And if treatments target to just straight away, then there is a chance for improvement. But with time, these pigment cells go deeper into the skin. Once it goes deeper into the skin, which we call dermal pigmentation, it is very difficult to treat. Not impossible, but very difficult to treat. So that is where it's important to kind of start treatment early, start prevention early, so it doesn't get to that stage.
Wow, yeah. So it's a wide topic, isn't it, really? And I think in general, people talk about skin cancer, don't they? Really?
Yes.
And so is it related? Does it, lead into skin cancers if not treated?
That's a good question. Now, facial pigmentation such as melasma or tanning or post-inflammatory hyperpigmentation itself doesn't change into skin cancer. But word of caution is, if on the body there are the people develop these light or dark patches from no cause. So if there has been no psoriasis, no eczema, no burn or trauma, and just suddenly these patches erupt, then you have to be cautious, because there is a condition called cutaneous lymphoma, and these are kind of very slow growing skin cancers, and they take a long time for us to diagnose. But it is important then to be alert and see your GP and get referred, because we biopsy the skin, take a small piece of the skin and check out a microscope to see if that is happening. So those are patches on the skin, dark or pale, with usually they are asymptomatic. That means they're not itchy, they're not dry, they don't do anything. And they're usually in hidden areas in the body, such as your underarms, your inner thighs, your buttocks. That you have to make alert. Second thing where you have to be alert is if a mole changes in size, shape, color, becomes darker or becomes irregular or becomes raised suddenly or starts to bleed or itch, that can be a sign of skin cancer. In darker skin cancers are more common in the nails and on the soles of the feet and the palms. So that is something that we have to be alert to, because we don't probably see our nails or check them every day. But if you have a new band of pigmentation on your nails, if that is changing, anything like that, important to get help.
Wow, yeah. So I think a lot of people would probably ignore, if there are some like little spots and stuff like that. How soon should people go? Is it because is it when it starts growing bigger, or is it something just appears?
Yes. So the key is change. So if you've had a mole that you've had since birth and it's just remained the same, it hasn't changed at all, doesn't bother you, it's not itchy or anything, you don't have to seek help. But if you have a new mole that is developed and it is changing, today it's like kind of, let's say, a nice small spot and it's even in color. And then a few weeks later or a few months later, you think, oh, this looks different. It looks darker. The shape has changed. It looks like a flower now, or the edges look irregular, or you notice it because it becomes itchy, anything like that, you should seek help immediately. So see your GP immediately, and these are referred to us in what we call a skin cancer pathway or a 2-week pathway. So from GPs, if you have, let's say if you have acne or eczema, you will be waiting to see a dermatologist for many months, because that's how huge the waiting list is. You'll be waiting for anything for 4 to 6 months or even longer. But if you have a suspicious lesion, a lesion that has changed, and the question is it skin cancer, you will have to be seen within 2 weeks.
All right.
So it is important that the first port of call is to see your GP and say, I have this mole that looks different, it has changed. And then they usually refer.
Okay, yeah, interesting, because it's important that you need to not ignore it, I think is the
Exactly,
word.
that's the key. Yes.
Yeah. Okay, so in terms of, I know we've talked a lot about it, and we've also got the way where you can be referred through the NHS. There will be a lot of people who might just want private treatment, etc. Can they approach you, and how do they get in touch with you?
Yes, absolutely. Yes, NHS work is there anyway. And privately, I have a website, and people can contact me directly from the website, or the website has a telephone number as well. I have my social media channels, Instagram, Twitter, Facebook. So people can text me on DM me or whatever on those channels as well.
Yeah, I will definitely be sharing all the links on our Facebook page, and of course, people will be able to ask if they want to know anything. They can always message me, and I can pass the information over to you.
Sure.
Oh, very interesting talking. Anything else you would like to add while we are all on? Got plenty of time yet.
Yes. So a couple of things. The one thing is I want to stress upon the sunscreen application for pigmentation again, because that is the key for prevention. So I want to kind of go through it in a bit more detail.
Okay.
So for pigmentation is formed from, like I said, UV rays and visible rays. So UVA causes aging. So A for aging, UVB causes sunburn, B for sunburn, and then there is visible light. Most of the sunscreens available in supermarkets, Tesco, Asda, so all, they protect against UVA and UVB, which is relevant for fair skin people to prevent skin cancer, which is absolutely fine. But for pigmentation, those sunscreens are not enough, because research has shown that the visible light of the sun as well is a cause for pigmentation. So we need to have the sunscreen which covers and protects against that as well. So I'll go through the brands that you can choose from, and also the ingredients you can look for. So if you look, any sunscreen with SPF 30 plus, which says broad spectrum UVA, UVB, and importantly, which says mineral on it, or in the ingredients which has zinc oxide, titanium oxide, or iron oxide, those are the ones that people with pigmentation, darker skin should use if you want to prevent or protect skin from pigmentation. Some of the brands that are available, which has all these right ingredients, is Anthelios XL Ultralight Tinted Fluid. That's a good one. You've got DermaQuest, which does a zinc mineral sunscreen, and that I think has a matte finish. So that's quite good. It almost acts like a foundation. Then you've got Heliocare 360 Mineral. That is a good one as well. Neostrata does what we call a CS Zinc Physical Protection. Neutrogena. So these are the brands. So Neutrogena, Neostrata, DermaQuest, Heliocare, Anthelios XL. There are more, but these are decent brands. And these are brands that dermatologists kind of usually trust. Now, how often do you have to apply sunscreens? Sunscreen has to be applied regularly. There's no point applying it before you go out in the morning and then you forget about it, because sweat, whatever, it rubs off. So sunscreen has to be applied regularly. Usually the way to do it is 30 minutes before you go out, and then, although we say every 2 hours, we have to be practical, and not everyone can keep putting the sunscreen every 2 hours. So if you do it in the morning before you go out, lunchtime before you leave the office, so I don't know what, 8 o'clock, 12 and 4 p.m., that is usually sufficient. Now, because you have to reapply, and for women, there is makeup and all that as well. Sometimes rubbing a sunscreen off will make it difficult. So there are compact sunscreens. And the ones which have the right one for pigmentation, the mineral sunscreens, Clarins does one. Clarins does a mineral sun care compact. Heliocare So Clarins and Heliocare, they do mineral compacts, and those are compacts, so you can easily reapply, so you're not worried about your makeup. Now, also, how much should you apply? That is important. And studies have shown that most people might apply like a few drops and rub it onto the whole face, and it hardly protects. It might, you have at least 40-50% of the face that hasn't been protected at all. So if you think about what we call a teaspoon rule, so 1 teaspoon of sunscreen for the face and neck, that is how much you should apply. So that is a lot. And I think people don't even do kind of 1/4 of it. And when you're outside on a holiday or whatever, and if you want to put sunscreen on your body, 1 teaspoon again for each arm, 1 teaspoon for each leg, 1 teaspoon for the front, 1 teaspoon for your back. So that's easy. A teaspoon for every area and a teaspoon for the face and neck. That is how much sunscreen you should apply. Again, layering. Now I know, especially for women, you have a moisturizer, you have a serum, you have sunscreen. So kind of how do you wear, and how do you apply them? If you're using a serum, that should be the first thing that is going on, because that has all the active ingredients in it. It has like all the anti-aging ingredients like vitamin C, peptides, so on. So that should be the first layer. You put that on, leave it for 5-10 minutes, and then your moisturizer. After your moisturizer goes your sunscreen. If you have a broad spectrum sunscreen which covers UVA, UVB, and visible, you can put it all together. It's all one application. If you have it as separate, then you do the chemical sunscreen first, which is a UVA, UVB protection, and then the mineral one next. And then the last layer is the makeup. So you've got your serum, after 5 minutes your moisturizer, your sunscreen, and then the last is your makeup, whatever you do.
Wow, it's such a complicated process, isn't it, for ladies? It's been really interesting talking to you today. And well, the radio, as you know, is reaching out to the whole of UK, and it's also reaching worldwide. And it's there for you to come and use anytime. Feel free to pop in if you want to pop in again at some point, you know, stay connected with us. Yes, anything else before we leave you?
Whilst we're on, once we're on this, we'll talk about skin and pigmentation, all that. But if people have enjoyed the talk, if people found it useful, I support a charity called ACOM. This is a charity which started off in Chennai by a pediatrician, where what her vision was that no child should be denied treatment because of lack of finances. So she started off small, and now she has received many awards in India. She has ACOM throughout India, and then there's a branch in USA and branch in UK. What our aim is to help reach healthcare for all the poor and underprivileged children in India. And the way she does it is she helps the funds, she ties with private hospitals, and our funds and training, all that is used with private hospitals to treat those patients. There is a website, and if people donate, it is very clear as to, there's an audit that comes through of where your money has gone, who received treatment, etc. It is quite, ACOM USA has done a lot of work where children are involved as well. In UK, in the Northeast Telugu group, they had done a charity run with children. Kind of in the lockdown time, all children had done a challenge and exercise, and they had raised £8,000 towards the charity. So we want to do more. We want to kind of spread the word, help involve children as much as possible, which we call ACOM Youth Ambassadors. And these children, it will help them in their career, because I know it comes under voluntary work. So for Duke of Edinburgh, whatever, it is helpful for them. It is helpful for their growth, and it is obviously for a good cause. And it only doesn't, our charity doesn't kind of only limit itself to India. We're supporting charities in UK. And if you remember the Chennai floods, they did a lot at that time. So all those funds will help towards that. Recently, with the COVID situation, the funds will help for migrant workers. So it is a reliable, sometimes we get emotional when we're sitting here, we see the migrant workers suffering. We're like, oh, where is a reliable source to support or send your donations to? This is a reliable charity. So yes, I would like we'll put some links out. Hopefully
Oh
you can look
yeah,
at them.
it looks like you're doing such an amazing work there. Yes, please do share them with me. I will put them onto our website, and we'll also link up all the information with our social media page, so we get as much message out as possible, and yeah, help that charity. So people, I'm sure, will relate to that. Yes, so thank you so much for coming. I'm sorry there has been a little bit of a mix up on the link on the website. I'm hoping it's gone out okay, but not to worry. This is something that we've started. It's just been developed, but we're reaching a lot of people, which is the most important thing. Yeah, thank you for your time, and I look forward to having a chat with you after this next track I'm going to put, and then we'll link up with what we want to do for the future as well. I'm sure people will want you to come back and talk a little bit more. So